My name is Jeremy Konyndyk. I'm the president of Refugees International, uh, and it is my distinct honor and privilege to convene this phenomenal panel that we have today to talk about the growing famine in Gaza. We are joined by some incredible experts, really foremost global experts in their fields, people who have worked on famine around the world, people who have worked on the famine in Gaza, people who have close familiarity with the crisis that's growing there. We're going to talk about this famine, everything from a very granular level of what is happening uh, to people, to Palestinians in Gaza on a day-to-day basis, up to what this looks like, this really unprecedented famine looks like in a global perspective and in a historical perspective. Just to refresh everyone on the situation, the IPC, the Integrated Phase Classification System, that is the global system for monitoring and assessing famine risk, has assessed that the entire population of the Gaza Strip is in a massive, massive food crisis in IPC phase 3 or above, the entire population. That is unprecedented historically to have 100% of a population in IPC phase 3 and above. It's an extraordinary thing. Perhaps more extraordinary is that over 1 million people are assessed to be in phase 5, catastrophe, the highest phase on the IPC scale. Certainly in my career, I cannot remember a time when that share of a population has been in IPC phase 5, even in something like the 2011 famine in Somalia. The share of the population in phase 5 was considerably below that. So this is a really historically unprecedented famine. And it is one that is obviously getting much worse. So we are joined by an incredible panel today to talk both about what that famine looks like in day-to-day reality in Gaza, and also talk about what needs to be done now to probably not prevent it anymore. I think the prevention window has closed, but to contain and mitigate the severity of it before the risk of real exponential malnutrition and exponential mortality begins to really take off. So I will quickly introduce everyone on our panel, and then we'll begin the discussion and put a number of questions to them. So we are very privileged to be joined by Nuha Bashir. Nuha is an expert in monitoring and evaluation, who's worked for a number of NGOs and development organizations over the years. She is a Palestinian from Gaza who is now living in Cairo, having fled there with her family during the war. And she is working now with Global Empowerment Mission, which is working to try and get aid into Gaza. We're joined by Dr. Nahreen Ahmed, who is a medical doctor with the NGO MedGlobal, who has worked on has done several deployments into Gaza, providing medical services in hospitals there, including just in the past few weeks, working in Gaza and doing some assessment and response work in northern Gaza. So she will have some fairly fresh perspective on what the conditions look like on the ground. Zeina Jamaluddine is an expert researcher and epidemiologist at the London School of Hygiene and Tropical Medicine, who has been working on famine analysis and mortality projections with LS-HTM and Johns Hopkins. And finally, Alex DeWaal is a world-renowned famine researcher who has written and kind of definitive research on nearly every famine going back to the early 90s, and will be able to help us kind of understand what we're seeing in Gaza from a historical perspective. So it's an incredible, incredible panel. And without further ado from me, I want to turn first to Nuha. Nuha, tell us what you are hearing. I know you are still in regular contact with your extended family in Gaza. What are you hearing from them about conditions?
First of all, thank you so much for having me today. Actually, what I'm keep hearing from people and from my family there, that there is a mass destruction of homes, people killed, People are injured. People are always reporting missing and trapped under the rubble. There are continuous bombardments, which always brought the death toll to increase hourly, including women and children and babies as well. And we know that there is a constant cut to power, water, and food, which made daily life nearly impossible there in Gaza, because since the beginning of this war, there was a total cut of power and water and even I mean food entry and aid to Gaza was a challenging, and it still continues to be a challenge. And this was one of the most like incredible reasons which allowed me to move out of Gaza after 1 month of the war, because I have twin girls. I could like be powerless to see my children under danger awaiting death, and because of that, we decided to leave at that time to protect our children. What we always keep watching, that like hundreds of thousands of housing units being demolished and bombed, and either like destroyed totally or damaged since the start of this war. Schools, hospitals, mosques are being as well bombed, and again, fuel, food, and water are always these days running out. The situation is terrible. I talk to my family and my colleagues and friends every day. The situation is really catastrophic, and I mean, prior to what is going on in Gaza Strip these days, I mean, people in Gaza were estimated to be facing acute food insecurity. That was before even the starting of this war, and over 80% of people were depending totally on a humanitarian aid. So, I mean, nonetheless, before the 7th of October, large amounts of humanitarian assistance reached the population. That was before the 7th of October. And there was some kind of enough food in Gaza to feed the population. But now people are really dying, and many more are sick, patient, injured, trapped under the rubble, etc. And Dr. Nahreen, she was there, and she even saw the catastrophe on the ground. She will elaborate more on this, I believe. Everyone there has lost more than a quarter of their body weight, by the way, due to the malnutrition, to the lack of food, to the lack of like healthy food, fruits, I mean, at the level of the children themselves. You cannot imagine how it's really devastating to see children. They are losing their weight. They are malnourished, and facing many health problems. And at the level of aid groups, I mean, 4 months now, aid groups have struggled to get food to an estimated 300,000 people estimated to be in the north of Gaza. And we all know that the north of Gaza is really facing a huge challenges in finding food to eat these days. And they are, I mean, is struggling to find like anything to have. And the crisis even worsened last week when the food charity World Central Kitchen, barely the only organization outside the UN regularly providing hot meals, they were suspending their operation after the Israeli strikes killed 7 of their staff members. And in this regard, in particular, I would like to raise something really important about the delivery of aids and food and fuel to Gaza. I mean, delivering aid to Gaza is really challenging, and this hindering all the humanitarian actors and humanitarian assistance, and depriving the civilians of the means to survive. The process of moving aid to Gaza is a tough process. It's very complicated. There are a lot of partners who are trying to support Gaza to send aid, whether through Egypt or through Jordan, and some other. They tried to use the maritime corridor. What adds to the situation is the undermining of the ability of the UNRWA to carry out its recognized role in distributing aid in Gaza, and which again this have aggravated the situation more and more. And I would like to highlight something to sum up the description of the context there is that no one will be able to scale up, I mean, operation and supporting Gaza unless there is more like entry points and a ceasefire. And this will only work if ceasefire will be there, if humanitarian aid workers are operating in a safe environment, and which I mean, this implicates that there has to be respect for their protection because of the urgent need to access the most vulnerable throughout the Gaza Strip. Nowadays, I'm volunteering with the Global Empowerment Mission, and we have been successful in dispatching 105 trucks into Gaza, and we are preparing other tracks these days as well. Our support to Gaza includes sending food, sending with our partners, of course, in Cairo, sending non-food items, medicine, and different aid commodities. We have a very big warehouse in Cairo, which serves as a hub, providing logistic support for different partners responding to the humanitarian needs in Gaza Strip. So that's like in a brief about the situation and how I like see things and hear from my colleagues and family there in Gaza Strip, and what we are doing here from Cairo these days. Thank you so much. If anyone have a question, please let me know. Thank you.
And just for everyone who's tuning in, we will open this up for questions in the second half. Nuha, thank you for that. I think your point towards the end on a ceasefire is one that many in the NGO community, ourselves and many other organizations have been calling for now for several months for exactly the reasons you described, that it's very hard to envision an adequate famine response as long as this conflict is being carried out in the way that it's been carried out. And so a ceasefire is necessary. And it was encouraging to see reports last night that it appears President Biden has now called for a ceasefire on its own merits, given the severity of the famine situation. Obviously, I think everyone hopes for a hostage release, but making that a condition of fighting famine, which is functionally what the approach has been, really isn't tenable anymore. Nahreen, I want to turn to you. You're one of the few foreign doctors who's been able to get into northern Gaza in recent months. Tell us about what you saw there, what MedGlobal has been doing, and what are you witnessing about the trajectory that this famine is on?
Yeah, so I think just to piggyback off of a lot of what Nuha said, which was really, she made some incredibly important points that I can corroborate on my trip to the north. So just to put into context the difficulty of even navigating this space. So to get to the north, you need to join a UN convoy. There's really no other way to get up there at this moment. The roads are absolutely destroyed. You need specialized vehicles, SUVs with four-wheel drive. There are armored cars going up because there are still reportedly hostilities happening along the way, which is true. On the day that we went up, that was the initiation of the second siege on Shifa Hospital. And so we had to actually change routes to get up there. And I mentioned that because, to Nuha's point, aid cannot be distributed when there's ongoing hostilities. And that is a big part of why it's such a challenge to get aid trucks up to the north. The second thing is what you witness, all around is that, mostly everything in northern Gaza, above Wadi Gaza, is rubble. And this idea that of rebuilding and recovery and food distribution, all of that just seems incredibly challenging with the destruction that has happened throughout all of Gaza. after that, you start to wonder where some of this data comes from. And so as I got closer to the north, and you see that it is challenging for people to move, it's challenging for aid workers that are working in the north to actually get from shelter to shelter. So you can imagine that the data that it is being collected is almost definitively underestimating what's happening. And in seeing our staff. So we got to Kamal Adwan Hospital as one of the hospitals that we assessed. It's a pediatric hospital where I'll go into a little bit of what I saw. But my first impression was seeing two members that work with MedGlobal. And the first thing I noticed is that their own weight loss. And it's one of the first things they talk about when I ask them how they're doing. And they mention their lack of access to food, how much weight they've lost, how desperate it is to actually even try and get food for them and their family. Secondly, and entering the hospital, nearly everywhere I looked, both patients were mostly children and their caregivers have very visible characteristics of malnutrition. The children who are admitted have severe characteristics of severe acute malnutrition, and they are admitted with multiple complications. And I think this is where some of the misconceptions that there's some misconceptions about how to fix the problem. As Nuha mentioned, before the war, already food insecurity was a problem, and it has been exacerbated by what's happening right now. This is not an easy fix. In the medical world, we talk about refeeding syndrome. We talk about the complications of severe acute malnutrition, of moderate acute malnutrition. These are different levels of the body under starvation and what happens to it. And it can lead to really severe things. This is not just people feeling hungry. And I think that that's a really important point to make here. This is organ failure. This is multi-organ failure. This is complications of infections, people's immune systems breaking down. And now we're thinking about who's the most vulnerable population. This is children. This is pregnant women, and children under the age of 5 especially. The long-lasting effects are an important point to make as well. For children especially, whose minds are still developing, cognitive impairment is a huge side effect of severe malnutrition. So, these are things that should not be happening. We absolutely need to figure out ways to prevent it, to treat it. But the second part of this is that even in treating, it's not just as simple as increasing the food distribution, which already will be a challenge in the north. But from a medical perspective, when we refeed, it is actually dangerous if a patient is not being monitored. And the reason for this is because electrolytes, the body kind of goes into shock when it gets refed. And so things kind of, for the layman, things kind of just go out of whack. Your electrolytes, your salt and potassium levels, things like that, they can all be dangerously high or low. I mean, they're kind of all over the place. And because of that, that can actually lead to fatal heart rhythms. And the process of refeeding can actually be deadly if not done under a monitoring circumstance. And so this is a long-term situation that we are looking at as far as reversing and managing acute malnutrition. And I think when the numbers come in, we have to be really cognizant of the fact that by the time this data is published, it's already outdated. And what I witnessed was that I went in January to Gaza, and then I went again in March. In that short period of time, even just witnessing people I had seen in January and seeing them again in March, it was a visible, significant weight loss, a visible desperation of trying to figure out how to access food. We were also seeing an increase in reported stillbirths. We're seeing an increase in reported complications that have a known, documented in research association with severe malnutrition. And I think this is where we really need to focus, that this is absolutely unconscionable, and it needs to be a long-term approach in order to help mitigate this. And so that's kind of where I'll pause for now, because I know we have many others that can speak on this as well.
Such important points, Nahreen, and I think in particular, observing that this is by the time a famine reaches this point, it's not just a food crisis anymore. It's a nutrition crisis. It's a health crisis, also a water crisis, and that reversing that then takes a much more comprehensive set of interventions, which we'll talk about in more detail in a little bit. Zeina, let's go to you. Nahreen talked about what this looks like at a human level, what she's seeing in some of the individuals she's met over her visits. We heard from Nuha about that as well. Um, Tell us about what this looks like now at a systems level. What is the data telling us? We know that a famine declaration, by the time it's declared, is a lagging indicator that reflects more about the data we've collected than the real-time reality. So tell us, what are we seeing? And you've been working on projections of mortality. How bad might this get?
Thank you, and thank you for letting me talk about this today. I think we're currently in the middle of basically every day counts when it comes to the famine. And if I just want to talk about adding to what Nuha and Nahreen have said, the majority of the population was reliant on food aid. And what we ended up doing is actually projecting what is available in the markets in Gaza, in warehouses in Gaza, from food assistance before the war, what people were able to get access in the market. By mid-December, WFP said that the market does not have any more stocks. By a certain point, also households start using all their stocks of food. What's happening when it comes to food truck coming into Gaza, and we quantified how much calories available per capita per day in Gaza. And we projected based on that the weight loss among adults. And as everyone has been saying, what we're currently seeing in the models is around 20 to 15% weight loss. And then we use that to then look at what would happen in an increase in acute malnutrition among children under 5. Why do I talk about children under 5? It's because this is the indicator that the IPC and other people look at when they look at determining famine. So we do use data sets from UNRWA really to understand before the war what was the acute malnutrition, and based on the weight loss and the calorie intake, what would be the acute malnutrition prevalence inside Gaza. Currently, what's happening in the north, we're seeing prevalences of around 36% based on the model. A month ago, even as 2-3 weeks ago, there were some data coming in from Juzur in Gaza showing that in the north of Gaza, showing prevalences of around 30% for mid-upper arm circumference, using mid-upper arm circumference screening. And the projections is that if this continues in the next 3 months in the north, in the same amount of food that's coming in, whether it's from food trucks or from airdrops of food, it will be around 56%. I think Alex can talk a lot about this, that this prevalence of acute malnutrition of 56% is not something we really see. And in fact, things are increasing exponentially as we move forward. What I want to also point out is people don't look at much at the south, but however, in the center and the south, currently the projections show a prevalence of around 10%, which is also similar to some data coming in. Rafah has a lower percentage. However, if the situation stays the same in the next 3 months with the same amount of food, this is going to accumulate in the same way as the north, maybe more prolonged, but it will reach around 36% in the next 3 months. So what I want to say in all of that is like these numbers, we're now coming out with them. We'll show more details about this. But this is very concerning when it comes to also adding up to the situation when it comes to the water situation, when it comes to the crowding situation. Currently, there are data coming in from the south that shows around 7 liters per person per day. We know in humanitarian research, you need 15 liters per person per day. There is around 500 to 600 people using one toilet in certain shelters, which actually predisposes it all to increase in infectious disease, and it's actually increasing already. My worry and worry of a lot of humanitarian actors is the combination between a cholera outbreak and an acute malnutrition. This is where we're going to see an exponential increase in mortality that currently is the current time to act is yesterday. But I think adding on to the voices of a ceasefire, of setting up medical points, of actually allowing humanitarian actors to come in and actually do the work that they need to do. To add up to that, the projections that we also did also included projections on mortality from NCDs. Gaza had very high prevalences of non-communicable diseases, so chronic diseases. Patients who have heart conditions are not able to go to hospital, get the treatments they need. Stroke, cancer patients, this has been talked about but these projections also show that an increase in excess mortality from cases that could be treated. The other element is actually maternal and newborn, like Nahreen has been talking about. We did project also what would happen with an increase in food insecurity on stillbirth and on newborn. In fact, the main issue that comes also into play in all of that is breastfeeding. We know that in this situation, women are in a very stressful environment. It's very hard to breastfeed in these conditions. And in wars in this region previously, we know that breastfeeding exclusively was cut in half. So whether it's in Lebanon and Syria and in Iraq, there is some data showing that when acute events happen, breastfeeding decreases significantly. And I cannot emphasize the urgency actually of promotion of breastfeeding, but in the situation like that, you need humanitarian actors to be able to come in and provide that. And so just to add to all of that, that we currently, I think to say is finalize is what also Nahreen and Nuha talked about is actually a ceasefire now. So yeah, thank you.
Thank you, Zeina. Those projections are incredibly disturbing, and I was thinking back to again to Somalia, the famine in 2011 that killed 260,000 people. I think the highest rates of global acute malnutrition there were in the 40s, and if you're talking about percentages in the 50s, that would again that would be virtually historically unprecedented if it reaches that point. And your point on cholera is incredibly well taken. There are cholera outbreaks surging in a number of countries right now. We've been very fortunate; it hasn't been detected in Gaza up to this point, although a lot of other diarrheal diseases have been. And if cholera were to reach there, it's very hard to see how it could be contained under the current circumstances. Which is probably a good, I don't know if a good is the quite term, but maybe an apt point to transition to Alex to talk about the global precedents with famine. How does Gaza stack up? Alex, you made some headlines a few weeks ago by observing that this could be the most intense famine the world had seen since World War II. I think to other famine watchers that felt intuitively correct. As someone who's been now runs the World Peace Foundation and has tracked these issues for a very long time, give us some of that. Put this in historical context for us.
Thank you, Jeremy. And you described the situation unequivocally as famine, and I think that's correct in my personal and professional opinion. Let's be clear, language about facing famine, imminent famine, is a bit euphemistic. The IPC levels 3 and especially 4 are bad. And in fact, when the IPC was first developed some 20 years ago, the very first prototype for the scale defined famine at a threshold that is somewhere between IPC levels 3 and 4. And the argument for doing so was that it was only when you cried famine that people responded. It was and it would be too late if we waited for what they in that prototype called severe famine. And I think that's absolutely correct, and that is borne out by what we're seeing now. And in fact, if you read the Famine Review Committee report from last month, and I'll quote, "All evidence points towards a major acceleration of death and malnutrition. Waiting for a retrospective famine classification before acting is indispensable." And to your question of putting this in historical perspective, we can measure famines along several different dimensions. There's intensity, there's magnitude, there's duration. Now, Gaza is not the biggest by magnitude, nor the most protracted. Those sort of regrettable qualifications, prizes belong to Sudan in terms of the numbers affected, to Congo or Yemen or South Sudan in terms of the protracted nature. What is unique and uniquely distressing about the Gaza situation is the speed of deterioration So a situation in which severe acute malnutrition 6 months ago was very low. It was a very food insecure population, but actual measures of malnutrition were remarkably low. The deterioration is at an unprecedented speed. And as you mentioned, we've never before seen a situation in which something like 95% of the population as of last month was in IPC levels 3, 4, and 5. And the sheer numbers in level 5, as of last month, some pushing 700,000, is unprecedented. The Somalia, which is the most grave famine for the last 25 years, at its worst had 490,000 in IPC level 5. So this is a situation that is, of course, entirely man-made, exceptionally intense, unfolding at a terrifying rate. And we have at World Peace Foundation compiled a historic catalogue of famines going back to the late 19th century. And it is very hard to find a case that matches it since World War II.
I find myself going back to some of the data from the 2011 Somalia famine as well as a reference point, and I'm consistently shocked at how, on a pound for pound basis, by almost every measure, Gaza seems to be on a much worse track, which is quite staggering to think about. Yeah, Alex, looking back at that historical record of famines, once a population is in this kind of situation, what then? What needs to happen? This will be kind of the second round of questions that will, we've gone from sort of the ground level up to 30,000 feet, and now we're going to drill back down. So, starting from that historical perspective, what does that history tell us about what needs to happen now?
Well, the first point to make, which I think is clear from these very powerful presentations that we've heard in the last half hour, a humanitarian crisis is like a very fast-moving freight train. So if the driver puts on the brakes, if we have everything that we're calling for now, it still is going to take a long time for this disaster to come to a halt. It can't be stopped overnight. And the level of dislocation, the level of destruction of all the infrastructure that is essential to survival, water, sanitation, hygiene, basic medical facilities, shelter, all these things are simply not in place. So that there, even if we avoid the worst case scenarios of an outbreak of cholera, there is still an significantly increased incidence of communicable disease. And then we have the crisis of individual malnutrition of children, which, as has been described, is not something that can simply be fixed by sending trucks across the border. This is not a simple sort of thing, a calculation of calories and saying, okay, we can actually increase the number of calories by airdrops or deliveries by sea or trucks. You need really specialized care in order to prevent these desperately vulnerable, desperately sick children in huge numbers from succumbing. So we need a ceasefire. We need an end to the destruction of everything that is indispensable to survival. We need a restoration of essential services and a full spectrum of specialized humanitarian assistance starting now. And even that will not be enough to save the lives of not insignificant number of people.
And I think an important piece of that, and maybe a good transition to Zeina, is we know in past famines, starvation can kill a lot of people, but disease can actually kill as many or more. And so it is more than just a food or even just a nutrition solution that's required when things get to this point. So Zeina, tell us a little bit about what this looks like now from the data that we're seeing. What are the challenges that need to be addressed? And then we'll go to Nahreen and Nuha for some thoughts on what that needs to look like on the front lines.
Yes. So, like it was mentioned by multiple people, that it is a multi-sectorial intervention that is needed. In fact, the healthcare system in Gaza has collapsed. The North Shifa Hospital stopped working, and we actually now need anyone who has severe acute malnutrition in the North. It's very I'm not sure whether they're able and where they're able to get the treatment they need, because what we need today is actually setting up medical points around shelters, around to ensure access to people that are in need. We need to actually be able to survey and monitor, to actually do community outreach, to understand what's happening. We also need to get to the hospitals that are semi-functioning, get some fuels within them to actually ensure that they have medication and they have fuel and electricity, clean water, set up lab capacities. I think this is something that we don't talk about a lot, but in order to prevent an outbreak, part of it is actually able to detect what's happening. People were able to recognize that hepatitis A is happening because there was a lot of symptoms, but until a person came from WHO with a kit that was able to figure out that it's actually hepatitis A, and we're not really able today to do some surveillance. So we need to set up surveillance and intervention strategies and mass vaccination campaigns, because actually the kids who were not vaccinated and need to pick up again. We need to, I think there has been some trauma stabilization points that have been set up, and increasing these, increasing possibly safe passage and corridors for people who are not able to access treatments in Gaza, but also actually able to currently, in terms of the nutrition situation, I think the community management of acute malnutrition approach and plan needs to be set up, which includes also stabilization points and ensuring possibly also blanket supplementation of supplements to be distributed, where we are actually seeing increase in acute malnutrition. And so there is a lot to do actually, and when it comes to the water situation, ensuring clean water and putting latrines in, and so it's and I think when it comes to also maternal and newborn, increasing safe and clean places to give birth in, increasing access to availability to skilled birth attendants and midwives, and when it comes to NCDs, when it comes to ensuring access to for chronic kidney disease patients to have access to hemodialysis, all of that, and I can talk more and more about cardiac catheterization labs, and there is a lot of need there. And so I think one of the things is ensuring a space and safety for in order to operate, to reach out to people that need all of that. And just to talk about the projections that we've done, that with an outbreak, there's around 85,000 that will die in the next 6 months if there's an escalation and a further attack in Rafah, even more than what's currently happening. And this does not only include death from trauma, but from all other diseases. If a ceasefire happens tomorrow, and hopefully it does, we still see around 11,000 excess mortality, so over and above what would be happening. That's because it's going to take time for all of this to happen. It's going to take time to be able to set up all of the healthcare system needed. People are still going to be in shelters because, like Nuha said, houses have been destroyed. So some are going to return, but the majority are still going to be in shelters for a long time. And I think there is all of that needs to come in to play, that with a ceasefire, we're still talking about excess mortality from all diseases. Trauma will decrease. There will be some people who have wounds that have not treated and will probably lead to mortality from some of this, but or ordinance on people being exposed to that. But the majority will start coming in from infectious diseases, NCDs, maternal newborn, and as main causes of death.
Yes.
Thank you.
Thanks for that, Zeina. I think that obviously a very grim outlook, but very consistent with what we're hearing. And I think what you're observing, particularly about the state of the health system, is a good transition to Dr. Nahreen to talk about what needs to happen on the health front. And Zeina made the point that what's needed is not just trucks but access. And I think that that echoes what you were describing about how advanced malnutrition, what advanced malnutrition treatment looks like. That this is not something that you can do off the back of a truck a couple times a month. So tell us about how does this now need to be operationalized? What do MedGlobal and other groups like other NGOs and particularly a lot of Palestinian-led organizations as well need in terms of safety and access to be able to put in place an adequate response? And then just a note to the audience, after we hear from Nahreen and Nuha, we're going to open it up for your questions. So if you do have questions, please type them into the Q&A function here in Zoom. We've seen a few come in, but we'll be turning to those in a moment. So please get in any questions you have. Nahreen.
Yeah, Jeremy, thanks. Zeina hit a lot of the high points. So, I'll just kind of summarize the way we look at this. Each organization kind of works on a small piece of the ecosystem, and each organization that is working in Gaza is important. The coordination mechanisms that exist right now need to be ramped up. The UN has been doing, on the ground, between the WHO, UNICEF, UNFPA, kind of hitting the priority organizations that we have worked with as MedGlobal in the context of maternal health, malnutrition, and overall health, including NCDs. There needs the scale up. There's so much to be done, as Zeina mentioned, and there needs to be additional international actors here, international governments that are involved, and when they are discussing how to help, there needs to be involvement of the right experts in those conversations. That is something I'm noticing as I'm having conversations with those, among the U.S. government about, what is aid distribution going to look like pre-ceasefire? What is it going to look like post-ceasefire? And I think it's important to make sure that the right people are sitting at the table. That includes Palestinian voices, and that includes health experts that can speak on malnutrition and overall health. When it comes to operationalizing this, I think there are a few other points to think about. Safety keeps coming up, and that is a priority. It's not just about international aid workers. This is about national aid workers, Gazan aid workers that have been working nonstop, constantly in unsafe conditions, and it is not getting attention until international aid workers are killed. And so I think we need to go back to safety and the safety of everybody as a whole that are working in Gaza in order to scale up the distribution of aid. And as Alex mentioned, the really highly specialized aid that needs to, and healthcare workers that need to get in and work on, especially the malnutrition side of things. What this looks like in the north is there needs to be, UNMAS needs to go up there and do the demining. Healthcare facilities need to be assessed to see what the safety of structural safety is. I mean, this is a giant ecosystem that we're talking about, and part of that ecosystem that needs to be addressed head on is infrastructure. A lot of what we're discussing cannot happen if there's not space to do it. And as far as access, I totally agree with Zeina that right now, because of the difficulty in movement for many people, bringing healthcare to them is mainly, what people have been doing. For instance, MedGlobal has 8 medical access points in different shelters. And the reason for that is because we're recognizing that bringing health to people is way more successful than having them come to us because of the difficulty and in movement and either finding a car or not having fuel, or just the safety of walking outside and the fear of being shot or in the middle of hostilities. And I think that's a really important point. And then I think on top of that, it's really scaling back up the primary care health system, as well as the secondary and tertiary, and for sure includes a significant focus on maternal health, which I think has often fallen to the wayside. There's been so much attention, and rightly so, on trauma injury and conflict injury. However, we are in a phase of this war where the secondary consequences have reached a point where we really need to focus on NCD exacerbation and maternal health complications. So it really needs to be looked at as a giant ecosystem where each it's very overwhelming if you take a step back and look at it. But I think there are many organizations that are specialized in many of these areas, and there needs to be a really well-coordinated approach to how to scale up the response.
And I think the point both you and Zeina are making too, that's not an instant process. That if there were a ceasefire tomorrow, it would still take a considerable amount of time just to get back to an adequate level of delivery capacity across the territory. Nuha, let's go to you for some final thoughts on what needs to happen and any kind of reactions and reflections you have to what you've heard.
Yeah, thank you. Actually, again, I would like to stress on the points raised by Dr. Nahreen and Zeina as well. An immediate lasting ceasefire would be the solution for what is going on. It's impossible to deliver aid and do like support to Gaza until we have like immediate lasting ceasefire, because it's impossible to deliver aid safely and at scale without the ceasefire. NGOs and different humanitarian actors need safe and sustained humanitarian access, more entry points to cover the Gaza Strip from north to south for humanitarian supplies, and more people on the ground to support humanitarian actors and partners. Also, aid workers need to be able to operate because staff and civilian safety and security remains a major concern these days. Again, humanitarian assistance, especially from the health perspective, must be delivered in a manner that does not cause harm to staff and to the population and to drive further displacement. Safe routes with Gaza and safe operating conditions for staff are also needed for a humanitarian aid to be transported, tracked, distributed, and monitored as well in a timely manner. One of the high priorities as well is to work on UXOs, as already Dr. Nahreen mentioned something about this, because demining and contamination in the north and even along the whole Gaza Strip is really important. I would like also to add another important point, which is funding. I mean, funding is really important because the scale is unprecedented and the need is really high. NGOs and local actor and even international actor offices and assets have all been destroyed, and there is a need to set up like a new operation from scratch, while still we know that deconfliction remains sometimes a major challenge to safeguard aid actors, operations and assets, which is, I mean, very expensive operations these days. The last point that I would like to add, as a like Palestinian from Gaza Strip, there will be really a need to strongly oppose the forcible displacement and the transfer of people, of Gazans. Thank you. Over.
Thanks for that, Nuha. We have about 10 minutes left. We've got a couple questions in the chat. I might summarize what we've gotten so far, and I'll just encourage the audience again to just use the Q&A function here in Zoom to put any questions you like to the panelists. The two we've gotten, one is around the experience of Palestinian doctors. What challenges are they facing in their day-to-day lives, providing services, while trying to keep themselves alive and live their own lives in Gaza as they do their critical work. And the other, and I think we've touched on this quite a bit in the course of the second half of the conversation, but what are the highest priorities for U.S. policymakers and for Congress? So Nahreen, maybe to you, just a little bit more on what you're seeing about the challenges and the needs of Palestinian doctors in your work there.
Yeah, I mean, so when I was there in January, I was working at Nasser Hospital right before it fell under siege. The last night there, the airstrikes were getting much closer. The hospital was surrounded by tanks. The Palestinian doctors that we worked with Many of them, their first thought was, I need to go find my family and make sure that they're safe. I think what's an important thing to remember is that every Palestinian doctor is displaced themselves. They are suffering from everything that their patients are also suffering from, and yet they are being relied on by the community and by international organizations to help collect information. It's a huge amount of stress that is on them, and yet they continue to show up. Palestinian doctors are worried that they're going to be arrested when hospitals fall under siege. I have met many that have been that were arrested for weeks at a time and questioned in absolutely horrific conditions, and still showed up to work again after that. And mainly, I think the resilience is what I really see as a response to that, and enduring care and need to help and continue to help their community, which is incredibly inspiring, but also devastating that they have to even be under those conditions. I think the major plea from them over and over again is that they're also lacking supplies. So, at the end of the day, not only are they themselves suffering, but they're suffering the moral injury of working in a hospital system where they are extremely well trained. They're incredibly knowledgeable. In fact, many times we learn from them. And what they're telling us is that we're not getting the supplies that we need. And so not being able to do their job and do it in the way that they need to, and seeing patients suffer because they don't have the tools necessary, you can only imagine that compounds the level of devastation for them as well. And so that's kind of the general thing that we've been seeing.
Thanks, Nahreen. Yeah, I think as we learned before during the pandemic, the commitment and the resilience of frontline healthcare workers is just really a staggering and impressive thing. Just really, really amazing. And it shouldn't have to be, but it is. Nuha, we have a question about how your family in Gaza are coping with the hunger crisis. If you want to share anything about what that experience is like for them, what struggles are they facing?
Actually, my family and most of families there in Gaza Strip, they are trying to cope, and they are trying to, use different coping mechanisms. Some of it is like, having one meal per day. Trying to make the food available for the children, not for the adults. Personally speaking, my mom, she keeps fasting, having only one meal, though she's sick. She's 75 years old, but she always saying that it's good to keep the food for the children, and I can survive with one meal a day. I know some families there, they sold many of their assets to try to buy, food, because it's, the prices are really skyrocketing. And sometimes, even accessing aid is not easy because, of the movement of the trucks, because it's like condensed in the far south, in Rafah and Khan Yunis sometimes. And it's really difficult to access, for example, from the middle area to access aid. And it's more for the people who are still staying in their places, in Deir al-Balah, for example, my city, because people who are still in their houses and the aid is distributed to the shelters and the schools, people who are staying in their houses, they are struggling, to receive aid. They always trying to buy it. And because of that, it's really expensive and they need to find a way to buy. So a lot of people, they sold their assets, and even they started to do to exchange. You can take this and I can take this. It's really hard. It's really hard. Many of people depending on canned food. Again, personally speaking, my mom, she was actually a healthy person. She never used to eat canned food, and up till now she's insisting not to eat canned food, and because of that she's trying to depend only on like a sandwich of olive oil all time, for example, and with like one cucumber, tomato, when it's available, of course, because it's really expensive. So people trying to cope with this with such type of coping mechanism, whether to reduce the meals per day, to save food for children, to sell their assets in order to be able to buy food. I heard a lot of like painful stories from my siblings. I mean, they were always telling me that we started to fed up with the lentil. We started to fed up with the canned food. I mean, people were like, I mean, missing to eat meat and the chicken or whatever. Even egg, egg for them these days is like, it's something fancy because it's really expensive, not affordable, and even the big families, they cannot afford to buy egg for the children. Yeah, so I mean, it's devastating. It hurts my heart when I speak about this issue, really.
And one of the things that strikes me about the examples you just gave is how those are really classic examples of negative famine coping mechanisms that we see everywhere else when there's famine. You're describing, to use the technical humanitarian language, you're talking about asset stripping, you're talking about meal substitution for less nutritious foods, and you're talking about skipping meals. And those are all like absolute classic examples of negative coping mechanisms indicative of severe food deprivation consistent with famine. So it's just, it is kind of taking some of that technical language and describing what is that looking like in the experience of your family. Just reinforces, I think, the gravity of what we're seeing here. We can go a few minutes over if our panelists are able to stay on for a few more minutes. I'm seeing nodding. So we'll take a couple more questions. I think on the policy question, we might end on that one. I'll do a final round with everyone just to give some thoughts on the one or two biggest policy priorities. Before we get to that, two more questions that we've gotten in. One, thoughts on challenges for orphans and unaccompanied minors in Gaza. And another on what kind of response is viable if restrictions and obstacles from the Israeli government remain in place. I don't know. Well, maybe just to anyone who'd like to answer either of those or has some thoughts to provide on either of those. Zeina, I see you coming off mute. Do you want to take it
I
first?
just want to talk about the airdrops and the seaport and all of that aspect.
Sure.
Because we did quantify how much is coming from it. It's very minimal. And it's mainly coming to the north for the airdrop. And also, you see what's happening when the airdrops are happening. People are going, there's people, they're being shot at. There is also some malfunctions of some airdrops where people are killed while they go get them. So this is just to say about an airdrop is not a solution. And it's the last thing we even want to talk about when we need to have an increase in assistance coming in from trucks, opening different border crossings. They know that there's been an announcement of an opening of a new crossing. However, this one is not a commercial one. It's not able to get in the amount of trucks we need. And in fact, just to talk about this whole element of even, I know that after the World-Centered Kitchen was coming in with a seaport and with a boat, including 400 metric tons of food, this was actually stopped, and they decided to not come to Gaza. So the current situation is that the solution should not be an airdrops. We should actually be focusing on increasing the trucks coming into Gaza. The amount of food that comes from airdrops, if you want to talk about it, is very minimal. It's like the last one that the UK did included 10 metric tons. And it's actually around like half of a truck. So they did, you do a whole plane to drop 10 metric tons instead of actually getting in half a truck. So you could think about the cost effectiveness of it all. Also, just this is not what's important, but just to also bring that forward in terms of how we're spending in humanitarian and efforts and what's coming in. Just at the point that also Nuha was talking about, I think we forget to talk about diet diversity as nutritionists because we're focusing on calorie intake. Micronutrient deficiency in Gaza before the war was very high. Anemia in women was actually quite high, and that stresses me a lot because today we're talking about the decrease in meat. Micronutrient supplementation has been actually, UNICEF has tried to bring in, but still needs to happen to a larger extent. I know that there was some lemon in the market, but in terms of scurvy, but this is definitely something that we start seeing in adults when it comes to micronutrient supplementation. I think micronutrients and diet diversity, I think this tends to be forgotten when the priority is always about, of course, about treatment of severe acute malnutrition. However, in adults and even in children, this is an element that also should be talked about. Sorry.
Yeah. No, that's great, Zeina. I think that the point that as long as the main routes and the main normal ways of distributing aid are being blocked, reliance on airdrops, reliance on this port, which incidentally, there was a report yesterday, it's going to cost $180 to $200 million to build this thing, which is a pretty expensive price tag when the other option is just open a border crossing. None of that offsets the blockages and the obstacles. Alex, when you look at other famines in history, are there instances where you've seen airdrops be the solution?
I don't think airdrops are really ever the solution. And in fact, they can be negative insofar as they pretend to be a solution and conceal real action. Yeah. But actually, there's another point that I want to raise here, which is the psychosocial trauma and the societal stress and trauma, that because a famine is not just individual starvation aggregated up. It's also the tearing apart of a social fabric, the violation of taboos, and the sense of humiliation that goes very, very deep in people and in communities, which can lead to social breakdown. And one of the worries that I see at the moment is that as it were, a focus on the arithmetic, the idea that you dismantle UNRWA, which has, not only the material infrastructure, but also the social infrastructure for responding. And you bring in an outside contractor, and World Central Kitchen was, doing a fantastic job, but it was not rooted in the community in the same way. And so, first of all, it's inefficient, but also it doesn't provide that social capital, that networking, that ability to actually preserve and begin to rebuild community. And if you don't do that, you can have these types of social breakdown that actually make it much more difficult to respond in the short term and to rebuild in the longer term.
So we can go for a few more minutes here. I don't know, Nahreen or Nuha, if either of you want to reflect on those last few points, and then maybe we'll do one more round asking about thoughts on the major priorities going forward.
Yeah, I think, what I want to mention, which is kind of what Alex and Zeina had kind of talked about a little bit, is I think there needs to be a restoration of dignity and how we treat people in this situation, right? And oftentimes when we talk about conflict and war zones, we forget to remember that, and I'm not saying we as a group, but I think in general we notice that emergency response tends to not really focus on restoring the dignity of an individual, which is something that is lost in the context of war, for a lot of the reasons that Alex, that you mentioned. But even, when you see people chasing after food trucks and chasing down aid being dropped, I mean, that's just a violation of individual dignity. I mean, it's just not, it's not humane by any means. And I think every part of an emergency response needs to keep that in mind, that there is worth of every individual that we are attempting to help, and there needs to be care in how we're responding. I think from an operational side, I think the points that Zeina made are really, really crucial, that people keep seeing and cheering on airdrops, but the amount of food that's coming in, or the amount of supplies that are coming in, are minimal. Not to mention, I mean, as Alex had talked about this earlier, there needs to be specialized care, and you cannot achieve that when you're just dropping supplies into the middle of Gaza. On top of which, regarding the port, again, the price tag of that can be put towards the massive rebuilding, something like $18 billion of damage already in Gaza. I mean, it's really like it's an unprecedented amount, and I think we need to be smart about how we're spending the money so that we can optimize the amount of aid. And to the last point, opening border crossings is so important, but I think taking it one step further back is the processes of getting aid in need to be streamlined. And we are 6 months into this, and I can tell you that I was on the ground in Cairo 2 weeks after October 7th, and the headaches that we had at that time, we are still experiencing now when it comes to aid movement. And while I cannot point a finger at anyone in particular, government or agency, because this is the responsibility of all involved. And I think those processes need to be simplified. We can't just order open border crossings. We actually need to simplify the processes as well.
Absolutely. Nuha, any additional thoughts on this? Or feel free to
I would like,
yeah,
thank you. I would like to comment on the question related to the orphan children and unaccompanied children. Actually, thousands of children in the Gaza Strip are unaccompanied or, orphaned. There is no accurate statistic because of the current situation and the unavailability of accurate data. Each one of those children is a heartbreaking story of loss and grief. It's nearly really impossible to gather and verify information under the current security and the humanitarian condition. But in the middle of a conflict, it's conflicts that families take care of children lost their parents. But currently, in the Gaza context, due to the sheer lack of food, water, or shelter, extended families are distressed and face challenges to immediately take care of their children themselves, as they themselves are struggling to cater for their own children and families. In these situations, I think immediate interim care must be made available at scale while keeping children connected or tracing their families so that they can be reunited or, when the situation is stabilized a bit. In this regard, the children's mental health is severely impacted. They present symptoms like extremely high level of persistence, anxiety, loss of appetite. They cannot sleep. They have emotional outbursts or panic every time they hear the bombing. The only way to have this mental health and psychosocial or psychological support delivered at scale is with a total and lasting ceasefire. Thank you.
Thank you, Nuha. So let's start wrapping up, and maybe just a final quick question, each of you. Highest priority. We all talked about the imperative of a ceasefire. I think that's well understood and well established. With a ceasefire in place, if a ceasefire is in place, what else? What are the biggest, what's the biggest thing that you would identify that needs to happen in order to begin getting this under control? Maybe we'll start with Alex, Zeina, Nahreen, and Nuha.
So I think it's really all been said, a sort of full spectrum of everything. Yeah. And immediately, at speed, and the capability for doing it is there, particularly with UNRWA. That is, the agency that can do this. Even though that will be stretched beyond its any limits that it has hitherto experienced. So I think it's really just a call to conscience for policymakers. It's not a matter of technical expertise. It's an issue of ethics. And I just want to just express my real appreciation for everything that has been shared by Nuha and Nahreen and Zeina over the last hour. I think it's tremendously important. And thank you, Jeremy, and Refugees International for convening this.
Thank you, Alex. Zeina.
Yeah, I don't have a lot to add to all of that, just to say that currently every week matters and we're in an exponential phase of it. So at the beginning, you see acute malnutrition increase slowly, and now we're exponentially it's going to increase. And so every week matters. emphasizing the role of UNRWA, I think is, I cannot emphasize it enough, because they were the agency that had the primary healthcare centers doing vaccination, providing medication for NCDs. They have the setup there. They were providing the assistance in collaboration with WFP. And so I think the role of UNRWA is essential in all of this, including other humanitarian actors on the ground. And everyone is tired. Like whenever I talk to people, they say that when we talked about how can we get more data, people, so we need a full humanitarian response to come in to support the people in Gaza currently, to establish the system. So ceasefire, I think, is the conclusion and all of that.
Yeah.
Permanent
And I think
ceasefire.
your point that every week matters and that we're nearing an exponential worsening of the humanitarian situation is something that really is not sunk in enough with policymakers yet, but it must. Nahreen.
Yeah, I think kind of what Alex mentioned, a lot has been said. I think my messaging, especially to policymakers, to those in governmental agencies, we need to stop politicizing human suffering. And I think seeing that happen over the course of 6 months has been disheartening. And it's so important that we are addressing the conscience, as Alex mentioned, of all governments across the globe to stand up and say that more needs to be done. And subsequently to that, on a smaller level, meaning like on an operational level, is kind of zooming in. I think access, we need to get access to all of Gaza, and we need to get access safely. And so again, I'll echo what everybody has been saying, but a permanent and lasting ceasefire is the only way to do that.
Thanks, Nahreen. Nuha, to you for the final word.
Confirming on my colleagues' points and just wrapping up with saying an immediate and lasting ceasefire is the top priority these days. Thank you.
Thanks, Nuha. It is really a privilege to hear from all of you, and the expertise on this panel is really stunning. It's just it's impressive and staggering, and thank you for sharing it with us and with this audience today. I know all of you are going to continue pushing on this. Refugees International will continue pushing on this. I hope all of you who've tuned in today will do your part in pushing on this. We need global policymakers, global leaders to get this under control. And I think one clear message from what we've heard today is the obstacle here is not that we don't know what to do. It's not that we don't have the tools to do it. It's that we are not, as humanitarians, currently able to do what we know how to do and to deploy the tools that we have. And we need, as soon as possible, to begin doing that. And as Zeina said, every week matters. Thank you so much to all of you who have hung on now to the end, stayed the extra time. Thank you so much to our panelists. And thank you also to Sarah Sheffer and Elisa Leal from RI, and Jesse Marks, our Middle East lead, for organizing this amazing event. Thank you, everyone.
Thank you.
Thank you.